Hello, my name is Vandana and today I'll be talking about rehabilitation of a patient, especially an athlete, after reconstructive surgery of ACL. Now, everybody knows that ACL is one of the primary stabilizing structure of your knee. The main word for ACL is to prevent that anterior translation of tibia, but it also acts as a secondary restraint to tibial rotations and the varus valgus stresses. Most injuries to ACL are non-contact injuries, especially in females. The injury in females is also very common as compared to males, and it's commonly seen in sports such as football, skiing, or gymnastics, where the athletes are involved in activities such as pivoting or cutting maneuvers, where they are running and changing direction, right? And you see such injuries commonly in a much younger age group, around 15 to 25 years of age. So the rehab really needs to be strong to ensure that they have a good function of the knee for the rest of their life. ACL ruptures leave the patient with much joint instability during all functional tasks. 2/3 of the patients do not return to pre-injury level of sport within the first year of reconstructive surgery. And up to a third or sometimes even a quarter of patients sustain a second ACL injury. So this rate of re-injury of ACL is still very high, despite so much of research that has gone into what's the best surgical practice and what's the best rehab practice. I believe that the rate of re-injury is still very high. Athletes which play at professional levels sometimes play at recreational or non-competitive levels after their ACL reconstructive surgeries. So the rehab quality has to be so good to ensure that they can go back to their professional level of playing and they do not recur any re-injury. So me tell you about whatever is currently the evidence, currently the best practices known to prevent re-injuries and going back to playing at the level at which they were playing. So in the 90s, the concept of accelerated rehab evolved in an effort to return athletes to the playing field quicker than ever. Initially, rehab used to be much slower, weight bearing or exercises used to follow a regime which were much slower. But nowadays, because of the surgical techniques that are used and what we know about the biomechanical principles of ACL, a much accelerated program is followed. So let's see what are these stages of rehab. There is a very important pre-operative rehab stage in ACL reconstructive surgery rehab. And as you may already know, ACL surgeries are not an emergency procedure. In fact, surgeries which are done after the knee has lost its initial swelling and has gained range and strength, the results are much better for surgeries as compared to surgeries which are done immediately after injury. So there is a big stage of prehab or the preoperative rehab where therapists have a role to play, which ensure that the success of surgery is higher. As goes for any kind of an operative procedure, there are 3 stages, what we say. There's a stage of maximum protection, a moderate protection, and minimum protection, which is done. But there are these extra stages in an ACL reconstructive surgeries. Rehab is when we are training the athlete to return to sport. And there is a stage when the athlete is a part of rehab to prevent re-injury. So these rehab for these patients is pretty long. Sometimes it may be a year, sometimes it may be lifelong to ensure that they don't have any re-injury. And there is no marked duration for moving on from one stage to another. It's not that at the end of 2 weeks, I'll go from stage 2 to 3. That does not happen. These are very criterion dependent and it's very individualistic. It differs from patient to patient. If a person is able to achieve a certain targets or goals, that is when the person moves from one stage to another. So they are very criterion dependent. So let's understand what are these criteria to move from one stage to another during rehab. The commonest questions that you will be asked will be regarding when will I regain my movement at the knee. So we believe as therapists that this prehab phase is the one where we try to gain full range of movement before surgery. The range is lost because of pain and swelling, and you would want to gain range at that time. Immediately after surgery, again, the patient will lose range. And in initial phases, the maximum protection phase is when we try to regain up to around 60, 70 degrees. And in the moderate phase, we go up to around 120 degrees. And beyond that, we would expect that the affected side has complete range of movement as compared to the contralateral side.